review some stuff about specifically cat cleaning and sanitation at the shelter. A lot of this applies to dogs as well, but since cats, there's a lot more hands-on stuff for cats than there's for dogs. So I just wanted to do a refresher so everyone's doing the same thing. So with cleaning, no, it's not going to work. 1 second. Maybe I have to stand behind you guys, which is a little. Okay, so cleaning. So why do we care about cleaning? So basically, disease is caused by bacteria, viruses, and fungi, which are all microscopic. These diseases are spread through body secretions in the air or by fomites. So a fomite is anything that touches a contaminated surface or animal. So brushes, bowls, leashes, towels, bedding, the floor, our hands, clothes, shoes. So those are all fomites, which are sources of disease. So if you think about the spread of disease, let's say you're petting a cat. You then take that hand that you didn't wash or put a glove on, you stick it into a bag of food. Then you go to get a new bowl of food for another kitty, and you've just spread the disease from the first cat to this new cat on the bottom. And the bag of food is now contaminated with that first cat's disease. So anyone else who gets food out of that bag will have contaminated food. So another example, if you're scooping a dirty litter box, and then you put your hand, that dirty hand, into the new litter to get clean litter to put in that dirty box, the next cat who gets litter from that hand will have all the germs from the previous cat. And again, that bin of cat litter is now contaminated. So another example, you're cleaning litter boxes. You take a dirty litter box, you put it on the edge of the garbage pan. Then you get the next cat, you put that cat's litter box on the pan of the garbage, on the side of the garbage bin. And now that cat, since that litter box touched where that other litter box was, is now contaminated. So just to give you an idea of how quickly and easily disease spreads, because we can't see it. So another example, you're petting a cat. Again, you don't wash your hands, you go to get new towels out of the laundry, and then the next cat who gets a fresh bed is contaminated. Same with a new dish, the next cat that gets that dish is contaminated. And same thing, if we're petting a cat and we don't clean our top or put on a different top, disease gets transmitted to the next cat, and same with dogs. Okay, so how do we stop all this disease spreading? So the first aspect is being aware of those fomites. So being aware of how we or things are transmitting disease. So washing hands, spraying things with rescue detergent, wearing scrub tops, gowns, gloves, watch where we're putting our dirty things, never touch something dirty, then touch clean without washing that hand or changing gloves or spraying with rescue. Always use new gloves or wash hands before touching something new, a new animal. And clean commonly used or high touch items with rescue. So things like brooms, brushes, garbage cans, countertops, door handles. Those are all places that people constantly touch. So there's higher risk of disease to be on those things. So just to go over hand washing a little bit more. So the proper way to get disease off your hands is to wash your hands for 20 whole seconds. That does not include rinsing. So it's literally lathering and rubbing your hands for 20 whole seconds. So that's to time 20 seconds, Happy Birthday Twice, or the whole ABC song, or Final Jeopardy, or Jolene, or We Will Rock You, or Raspberry Beret. So some more. So pop quiz, what is better at controlling diseases? Washing your hands or using hand sanitizer? Washing your hands, because hand sanitizer does not remove discharge debris from our hands, so it doesn't deactivate germs as well as a full wash. Go ahead.
Just one quick question. So it's wash your hands Or change your glove?
Yes.
It's not both.
Well, both is always great, but certainly if you have a glove on and you take that glove off and put a new glove on, that is a clean surface now. Yeah, that's fine. So scrub tops, just a little bit more about the scrub tops. So putting on a scrub top over our underclothes keeps our underclothes clean. So you must wear a new scrub top when you're cleaning, because when you're cleaning is when you're stirring up the most disease. So before you go into a room, putting on a scrub top will protect your underclothes from going on to the next. Also important to wear a scrub top when you're handling dirty laundry, and then take that dirty scrub top off before handling clean laundry. Because if you're using the same scrub top or shirt for handling dirty to clean, that's how disease gets spread. So volunteers always have to wear a scrub top when they're interacting with cats, because even as the previous slides, even just touching and petting and holding can make our surfaces dirty. And then when we're cleaning, one scrub top is fine to wear for the whole room. We don't have to change scrub tops between cats. That's excessive. And then remove that top when you're exiting a room, because it kind of defeats the purpose. If you wear the same scrub top through the whole building, you're tracking that disease through the whole building. So for actively sick cats that we have determined are sick, they have to have their own scrub top when you're working with them that gets removed and not used for other cats, because they actively are spreading disease. We don't want to, between cage to cage, we don't want to spread disease immediately that way. Okay. Any questions about that? Because that's an important one that everybody has to do.
With our sick cats, it's preferred to wear a gown?
I'm fine with either or. Gowns just have more protection, if you have the more full body protection and the sleeve protection, which is definitely better. Sleeves are better than no sleeves, but as long as you are conscious of what you're touching, and that if you do wash your hands, you wash up to your elbows. If you're not wearing a full gown.
So doctor,
Yes.
if I'm helping clean out, I adopt somebody out and I often help clean out the cage, as far as physical stuff,
Yes.
move stuff. Am I wearing my top? How am I logistically doing that? Taking the stuff to the laundry area.
Right. Anytime you are touching dirty, you should have something on to protect your clean underclothes.
Yeah. So I always have a scrub top on.
Mm-hmm.
But so I'm walking down the hall to get rid of the beds and laundry. So it's okay to still have that top on when I'm in.
Yes, in that situation, yes.
Okay.
Because, yes, that's a very good question, because you're going right to laundry. So I recommend you then, when you're in laundry, take that dirty scrub top and put it in laundry. That way you're walking back, interacting with new cats with that clean top.
Okay. Yeah.
Does that make sense, everybody?
Yes.
Great. Okay, so dishes. So dishes, litter box, toys, corunda beds have to be scrubbed and hand washed until clean. So a lot of people think that the sanitizer is a dishwasher. It's not. So if you put a dirty, visibly dirty item into the sanitizer, that crud will not get removed. And any crud that gets stayed on can harbor disease particles inside there. So if we pull a dirty litter box out and give it to another cat, that cat now is exposed to the disease. So make sure we hand wash and scrub the dishes clean before putting them into the sanitizer. Any questions about that? Great. Okay, so, and then daily handling of cats to avoid spread of disease. So gloves and towels. So again, this is all ideal. I know that things get busy and things get missed, things get forgotten, but if we're all trying our best all the time, that's how we're going to get disease to decrease. So anytime you're getting a cat out of a cage, anytime you're handling a cat, gloves, and wrap them in a towel to transport them, so we're keeping our tops clean. Okay. So the second part of stopping disease spread is proper cleaning and sanitation. So making sure we clear away debris first. So anything we see, we need to remove that first so cleaners can work. We're using the right cleaning products. So Rescue, not water, not Pine Sol, not Lysol. Rescue is the one that kills animal diseases. Using the right dilution. So if we just kind of make up our own dilution of a product, it's either not going to kill the disease or it's going to be harmful.
Excuse me.
Yes, go ahead.
Is this, like the daily cleaning of cats, you have to do this, or just when you're cleaning out the cage?
That's a really great point, and I will get to the difference between those two. Okay, so contact time. So all of these I will go into more deep detail, but basically it's making sure the chemical sits on a surface long enough to actually kill disease. And then the order that we clean animals in. So cleaning healthy cats first and sick last. That way we don't spread disease from animals that are actively shedding disease to the rest of the population. So cleaners can't work if there's crud, if there's debris. So always remove things you see with your eyes first with a wet paper towel. Even rescue is fine, but just know that that has to be removed first before the rescue can actually kill the disease. Okay. Diluting the cleaning brush talked about. So if a chemical isn't diluted well, it's either too strong and it'll hurt the animal, or it's too weak and it won't kill any disease. So just make sure that we're reading signs and measuring correctly. If there's any question about how much measurement is in each of these closets, let a staff member know and we will label it clearly. Okay. Never just eyeball it. Exactly. Okay, so contact time. So I talked a little bit about this already, but it's basically the amount of time a chemical needs to be in contact with a clean surface to kill germs on it before being wiped away. So the ready-to-use rescue is 1 full minute of contact. The diluted rescue that we use more commonly on floors, is 5 minutes. So how this works is you clean up your debris first. You either spray the surface with the rescue or soak a rag with rescue, wipe it on the surface that you are cleaning, wait 1 full minute, and then wipe it dry. Conversely, if it's something that we're not putting an animal right back into, you can spray the object and walk away. That's what I do a lot of times for disease, like really high risk disease things, like freezing a scale and measuring weighing a bunch of kittens. I'll soak that scale and just walk away. So I know that it's sitting there for a full minute and it's dead. The germs are definitely being killed. Just a reminder to never spray chemical right into a cat's face. That is not advised. Okay, so cleaning order we talked about a little bit already. Finish a whole room. When you're cleaning before going to a new room, there's no sense in mixing disease between rooms. So first, always clean healthy kittens if they're in your room. Obviously, keep within your room. Then the sick kittens, which will have shower curtains. Any FIV positive cats, healthy cats, leukemia cats, then sick adults that'll have their shower curtain. So another thing about shower curtains is the way that we are denoting that animals are actively sick, that we know are sick. So handle them as little as possible, because anytime you handle them, you have disease and you can transmit it. Okay. And when in doubt, don't handle them, and a staff member will likely do it anyway. Okay. Any questions about any of that? Okay. So spot cleaning versus deep cleaning, this kind of goes to your question. So spot cleaning is the daily cleaning we do for cats who are staying in their cage. Deep cleaning is when a cat is moving out of the cage completely. So the daily spot cleaning, the reason we do that is because it reduces stress, because it keeps the cat's scent on their things. It's not as disruptive as a full clean every day. But it also reduces disease because it's removing poop and food and things like that. So when you're doing a daily normal clean, you guys, make sure that you're checking all sides of the cage for debris. So there's the bottom, there's the right side with the portal. And this is like, you don't need to wipe all of these surfaces every day. You need to check to see if there's poop and food and litter on all of these surfaces every day. So left side, and make sure that little portal door, that can get poop on both sides of that. So check that. The back side. The top. A lot of times we forget about the top because we can't see it as well. So look for stuck on stuff up there. Then we have the front, the cage door with these latches that love to get food on them because that's where we touch. So check those. And then, of course, the cage door has two sides to it. So make sure we're checking the back side too. In particular, each cage bar, you see all the food that's stuck on that bar? That's something that we want to clean every day in those daily checks. And the back of the clipboards get pretty nasty too. So make sure we're checking that for that visible debris. And again, if you're looking at it and it looks clean, you don't have to do a full wipe down every single day. This is just getting that yucky, cruddy crap out of there. So once we've checked all of our cage for debris, check the corunda beds because poop gets stuck on those. Wipe up that debris like we talked about. So you're going to do your first pass just to get that debris off. And then you're going to spot clean with that rescue detergent and let it sit for a minute to kill the disease after we get that crud off. Make sure that you're picking up linens and shaking them out over the garbage to get loose food, litter, that kind of thing out of their cage. Wipe up any feces smears. I know with the litter boxes, we kind of empty the litter boxes and put them back. But if there's poop all over the sides, we can wipe up that poop. They don't have to live with a gross litter box. If things are very dirty, if there was blowout diarrhea, get a new litter box. We don't need to put that right back in with them. But also keep in mind, we don't want to crowd the cages with lots of stuff because A, that's more laundry, and B, it's more places for disease to hide. So we want to keep it comfortable, but it doesn't need to be, Pier 1 in there. Okay, and the cabana is the same principle, just tidying up, clearing up the debris we've seen. There's more spaces for debris to be. So the walls, the shelves, the corunda beds under those hiding spots. So make sure that we are looking for all of those spots that debris can be, wipe it up, do our spot clean. Again, we've got our linens, our feces. Again, okay. So that's the majority of the cleaning that at least volunteers, you guys are doing. So is there any question about how that's done?
I just wanted to ask you what you think the best way to do the bars are.
I literally will take a rescue soaked washcloth and just scrub them. Okay. Excuse me. So deep cleaning, pretty much staff members are going to be doing this. So that's when a cat got adopted or is moving to a different cage. We clean everything completely, deep clean it. So the next cat that comes in, there's no trace of disease at all. So usually done by staff members, everything's taken out. Again, we're still going to remove that visible debris first because if we spray a pile of poop, it's not going to kill any disease. Again, all our cage sides. Oops, okay, that was it. So the third aspect of how we stop disease spread is animal care. So identifying our sick animals. And keep in mind that not all animals who are sick are gonna look sick. That's why the gloves, the towels, the scrub tops is going to prevent the disease spread from animals that we think look okay, but may actually be shedding virus in their nose, their mouth, their poop, on their fur. So if we identify our sick, get them treated, get them covered, but we're also doing the daily protection of ourselves and the fomites, that's the best way to get disease under control. A lot of times we get animals with no medical history. We have no idea where they came from, what they've been exposed to, what if they've had vaccines. We get immune compromised animals with these viruses like FIV and leukemia. We get young animals with no immune system. We get old animals with compromised immune systems. The longer animals stay in the shelter, the more likely they are to get sick because it's just the way the game works, and stress. So as we all know, as humans too, when we're stressed, we're more likely to get sick. And this is a very stressful place. It's not as stressful as a lot of the shelters I've been to, but it's still stressful. It's not a home. So that's a big part of how we can stop disease spread. And so mitigating stress, a big thing that we need to remember is that every cat, even a cat that's super friendly and wants to come right up to you, deserves a place to hide because they don't want to be on all the time, So if you see a cage or a cabana, whatever, that there's no hiding space or the hiding space isn't well covered, like there's a blanket, but you can see the cat. Let's fix that. Get a staff member to help you if you need it. So you can see here, this cat has nowhere to hide. He's just, constantly being exposed versus a cat who can hide and have some chill time. Okay, so day-to-day takeaways, make sure to read signs. We are trying our best, if there are special things to look out for, to put signs up so you guys know what you're dealing with. Stop and think about what you just touched. If you touch something dirty, wait a second, make sure you're cleaning your hands before you touch the next thing or changing your gloves. When in doubt, wash your hands for 20 seconds. Let the chemical sit for the appropriate contact time to make sure we're actually killing disease. It's very tempting to spray cleaner and wipe it immediately, but you're getting rid of all of that cleaning power when you do that. Decrease stress. So again, the hiding spaces, toys, good food, nice music, quiet voices. Ask questions. If you see something that isn't quite sitting right with you or you're not sure how to do something, please ask. And of course, monitor for signs of disease. So lethargy, sneezing, coughing, discharge, not eating, vomit, diarrhea. Those are all the big ones. And certainly tell someone when you notice signs of disease right away. You can write in those monitoring sheets that we have is a good way to track over time, things like appetite, stool production, things like that. We have the med concern forms that you can fill out and give to the med staff. Or, tell a staff member and it'll get brought to our attention. All right, any questions? All right, okay, that was easy. Anything you guys want to share that you have noticed or think is working really well or not working well?
I have a question.
Sure.
Is there like a percentage of cats, I guess, that have disease? And I know you said like a lot of them are asymptomatic, but like in shelters, maybe nationwide or whatever, like what percentage of cats are carrying disease and may not show it?
That's a good question. So there's a saying in shelter medicine that all cats in a shelter have herpes virus. So herpes is a virus that they carry in their body, but only gets brought to the surface and shown symptoms when they're stressed. So, and it's very contagious. So basically, we think every cat who comes from a shelter has been exposed to this virus. So they might look totally healthy, and then in 6 months, they'll have runny eyes. And it's probably this herpes virus that has been living in their system the whole time. And as we've all probably noticed, we'll take in kittens, for example, and they'll look fine. And then the next day or a few days later, they'll have diarrhea, they'll stop eating. So I don't have a good percentage for you, but I would say that it's much more likely for disease to not be there when an animal first gets here, and then it'll develop in the shelter because of the high level of stress. Does that make sense?
Yeah.
Okay. Yeah.
I remember, probably all remember Lisa, who quickly got sick and seemed.
Oh, Lisa,
fine
yes.
and
Uh-huh.
Not fine the next.
Yeah.
What would you say, like, without taking a cat's temperature, is the best way to figure out if they have a fever?
A fever,
Yeah.
not eating. Appetite is one of the biggest things that I look for. And Chrissy probably knows, anytime a cat isn't eating, I'm like, let's take its temperature, let's check its hydration, especially a cat that has been eating well.
Right.
So appetite's probably number one. You can check their hydration. So if you pinch their skin, it'll be tacky, it'll stay in place, and lethargy. So if they're just kind of sitting around when normally they don't.
Looking.
Yeah. And that's why it can be difficult for cats that are really stressed, who aren't eating because they're stressed or hiding because they're stressed.
One day
Yeah.
and 2 days later was
Yeah.
not fine.
And it's tough. That's a really fine balance. And
Yeah.
I'm more of the proactive side where I like to, if a cat's not eating, let's take it out, let's give it fluids, even if it maybe doesn't need it, at least it's going to hopefully slow down any disease process. Thank you, guys. If you think of anything else, let me know. But thank you for your hard work and for your dedication and for your interest in this. That's really very appreciated.